When we look at the tremendous historical and cultural changes that have occurred in American Indian communities, that has a significant impact on self-esteem, self-identity, and a sense of empowerment or hope for the future. And when we have a population of people that feel disenfranchised or disconnected from tradition and from hope for a healthy future, that's going to have an impact on social behavior and whether or not people live in a healthy way. So not only is there unhealthy components of diabetes, there's also so much diabetes that what we've seen is a culture of diabetes. And when people grow up in a community where their grandparents, their parents, aunts, uncles, siblings, even children have all gotten diabetes, they've gone through the complications, including blindness, amputations, kidney failure and dialysis, and early death. If you have a non-community member who's a healthcare professional telling them that this is preventable, well, that might not be very believable based on the culture of diabetes and living with it. For example, in my own medical practice, I've had quite a number of patients who say things like, "I don't have diabetes yet." And what are they telling me? That they believe that they're going to get diabetes. And when you think about things historically and things from a cultural perspective, really the culture of diabetes has created generations of people who believe that it's inevitable. And in many ways it is. If we don't have healthy choices, we don't have community control and self-determination, in many ways, for some people, it seems like it is inevitable, but it doesn't have to be that way. And part of the social determinants of health is also a sense of hope for the future. And if people lose that sense of hope and their self-esteem is lowered, that's going to have an impact on self-destructive behaviors, and it's also going to make people think less about things like diabetes prevention. So we have to look at this from a much broader perspective, to not just think about physiology and food intake and physical activity, but what is going on in the behavioral health realm and the mental health realm of a community, because that's going to have a direct impact on health-related behaviors.